Hi there. In today's video, we'll be talking about obesity and how it is linked to dementia. This video is part of a series on how to identify and reduce risk factors for dementia. Dementia is a general term for loss of memory, language, problem-solving, and other thinking abilities that are severe enough to interfere with daily life. Alzheimer's disease and vascular dementia are two of the most common types of dementia. Did you know that 27% of Canadians are obese? Being obese puts people at risk for health conditions such as heart problems, diabetes, stroke, and some cancers. Many people are not aware that obesity increases the risk for dementia too. Body mass index, or BMI, is the most common way to measure which weight group you are categorized in. However, there are other ways obesity can be measured, such as by waist circumference. We will explore this more later in the video. But remember, while BMI and waist measurement can be a helpful guide, it is best to consult with your doctor to confirm whether you are obese or not. Let's start by discussing BMI. To measure your BMI, all you need is your height and weight. The U.S. Center for Disease Control, or CDC, provides a BMI calculator. Based on your BMI, it can tell you whether you are considered as underweight, average, overweight, or obese. For example, an average woman is about 5 feet 4 inches tall. If she weighs between 108 to 145 pounds, she would have a healthy BMI. But if she weighs 175 pounds or more, she would be in the obese category for BMI. The average man's height is about 5 feet 9 inches tall. If he weighs between 125 to 169 pounds, his BMI would be considered healthy. If he weighs over 204 pounds, he is obese. Besides BMI, obesity can also be measured by the amount of visceral fat someone has. Visceral fat is the fat in your stomach area that surrounds your organs, such as the kidneys and liver. High amounts of visceral fat increases the risk of many health problems, such as liver disease, cancer, and asthma. Some body shapes will have more visceral fat. People with an apple shape hold more fat in their stomach area and therefore will have more visceral fat. People with a pear shape have more fat in the lower parts of their body, such as the hips and legs, and tend to have less visceral fat. To measure visceral fat, you can measure the number of inches around your waist. Women who have a waist below 35 inches and men who have a waist below 40 inches are less likely to be obese or have health problems related to visceral fat. However, it is also important to consult with your doctor if you are concerned about your weight, as obesity has been linked to many negative health outcomes, including dementia. Studies have shown that obese adults between the ages of 45 and 65 have a 60% greater risk of getting dementia than their peers who are not obese. Middle-aged people who were obese and lost weight had improvements in their attention and memory. To manage your weight, here are some things you can do. First, it is very important to discuss your weight loss plans with a health professional, such as your family doctor, nutritionist, or dietitian. They can support you with your journey by providing safe and healthy resources. Start off with at least 30 minutes of exercise each day. Find an activity you enjoy doing, such as gardening, dancing, or walking, as it can help you to be consistently active. We provide more information about exercise in our active living video. Eat a healthy and nutritious diet, including fruits and vegetables, legumes, and protein. Planning your meals in advance can also help you stay on track with eating nutritious meals. Be consistent with your healthy eating habits and don't skip meals. Breakfast is especially important. Keep track of your diet and activity. Please see our nutrition video for more information on how to improve your diet. Get enough sleep. Having a poor sleep schedule can increase your appetite and make you more tired. This can result in being unmotivated to exercise and more likely to crave unhealthy foods. If you're having sleeping troubles, such as being unable to fall asleep or staying asleep, feel free to check out our video on how you can improve these habits to live a healthier and happier life. Asking for support from friends and family while you are on your weight loss journey can also help keep you motivated with your goals. It is worth the effort to lose weight if you are obese. Maintaining a healthy weight has many benefits for your physical health and your brain health.